Broadcast from the capital, Juba. My name is Emmanuel J, Akile, and it's Thursday, the 19th of December, 2024. It's about 14 minutes now after the hour of 7. Now, we are going to talk about the role of nurses and midwives in providing gender-sensitive health services, respecting human rights and addressing gender-based violence, and also protecting nurses, midwives, and other healthcare workers in South Sudan. I'm joined live in the studio by two guests, Mr. Repent Khamis, who is the president of South Sudan Nurses and Midwives Association, and also I'm joined live in the studio by Reverend Janet Michael, Director General of Nurses and Midwives, National Ministry of Health. It's good to have both of you in the studio this morning. Welcome to our radio.
Thank you so much, Mr. Emmanuel J.
Yes. Now, Reverend, let me start with you, and let's a little bit talk about extensive experience in with your experience in healthcare services and governance, and let's discuss the national strategies for integrating gender-sensitive approaches and also protecting healthcare workers. What would you say in that regard in general?
Thank you. Thank you. Good morning for our listeners this morning. And as we go through that, of course, gender issues has been rising. When we started practicing some time back, it was not very clearly defined. We practice what we talk of human rights, looking at the human being and providing the rights of that human being, and making sure that you look at that human being as an individual and taking into consideration of the rights of that person in accessing health, or when we are providing health. Individualized care of looking at that person as an individual who also has a right of their own. The gender issues has been coming up lately, pronouncing it very, very seriously, because at that time people didn't look at it as something that is a serious offense or a right. And in that aspect, we look at gender-based violence. We didn't take it seriously to bring it out that actually the person undergoing through violence has mental issues. I mean, is affected mentally, physically, and so people were suffering silently. Now, when these things has come up now, you have to see very clearly that you don't only see the person on the surface, but dig more deeper into the person, because that person came sick. Maybe it was an issue at home where her own or his violence has been, I mean, his rights have been violated because of his or her gender. And at least to probe and know, and then you apply the right treatment. Otherwise, we let people to go into mental depression, mental health, and illnesses. Sometimes we don't diagnose them. Then most of the time the people will be told, they said, oh, you know, that patient is stubborn. That person is aggressive. You know, we start terming them like that. But the recent trend now is for us to look more in depth in applying care.
Right.
Yeah.
Right. And Repen, let me bring you in and highlight to us some of the association's efforts really in advancing professional development and also advocating for nurses and midwives' welfare in general.
Thank you so much, Emmanuel J, for the opportunity, and I want to greet all our listeners for this morning as we are discussing very, very important issues pertaining to the welfare of our nurses. And in regards to that, Emmanuel, we have come with the position statement that I would like you to allow me to go through the position statement in regards to that. Let me begin with the background. The South Sudan, with the population of about 12.3 million people, has been facing a protracted humanitarian crisis with more than millions of people in need of assistance. South Sudan is also experiencing uncertainty and economic instability. These challenges have resulted in a significant strain on the health sector, where nurses and midwives plays a critical role in delivering essential healthcare services, particularly to vulnerable population, including women and children. Health workers, especially nurses and midwives, face heightened risk due to inadequate infrastructure, lack of resources, and frequent exposure to violence and harassment in their line of duty. The health and safety of nurses and midwives are paramount to ensure the continued delivery of essential health services. Unfortunately, health workers in South Sudan are often subject to unsafe working conditions, including exposure to infectious diseases, insufficient protective equipment, and psychological stress due to conflict and insecurity. There is an urgent need to address the issues to protect health workers, thereby safeguarding the healthcare system in South Sudan. Our position as the South Sudan Nurses and Midwifery Association, as a voice of nurses and midwives in South Sudan, number one is strongly advocate for the protection of healthcare workers, particularly nurses and midwives, through the implementation of comprehensive safety and security measures. This include the provision of adequate personal protective equipment, safe working environment, and mental health support. Number two, calls on the government of South Sudan and international partners to prioritize the safety and security of health workers by ensuring that health facilities are protected from violence and that there are clear policies in place to prevent and respond to any form of abuse or harassment against health workers. Number three, affirms the importance of ongoing training and capacity building for nurses and midwives in South Sudan. This includes training on infection prevention and control, emergency response, and self-care strategy to manage the stress associated with their role. Number four, encourage collaboration between government bodies, health organizations, and communities to create a safe and supportive environment for nurses and midwives. This includes community awareness, campaign to recognize and respect the role of the healthcare workers to promote a culture of nonviolence. Number five, urges stakeholders to invest in health sector, particularly in safety and well-being of the nurses and midwives. This investment should include the establishment of support systems such as counseling services, legal protection, and financial incentive to retain and protect the health workforce in South Sudan. Number six, believes that the protection of health workers is not only a matter of safety, but also of ensuring the continued delivery of essential health services to the people of South Sudan. Nurses and midwives must be supported to carry out their duties without fear in environments that are conducive to their professional and personal well-being. And seven, recommends that all health facilities in South Sudan implement and adhere to protocols that prioritize the safety of health workers, and that these protocols are regularly reviewed and updated in response to changing conditions and emerging threats. So thank you, Emmanuel. These are our positions in regards to the welfare of the nurses and midwives and other healthcare professionals in this country. Thank you.
Right. Thank you for that deep clarification. And we go for this short break, and when we come back, Reverend, I want to bring you in and as to the way forward and how can we really address all these challenges facing nurses and healthcare workers in general. After this short break, don't go away. Good morning.
Gender-based violence is a violation of human rights and a barrier to peace and development. Did you know that many women in South Sudan have experienced it? But together, we can change this. The 16 days of activism against gender-based violence is our chance to stand up, speak out, and support victims. So, what exactly is gender-based violence? Gender-based violence refers to harmful acts directed at individuals based on their gender. It includes rape, harassment, and more. Gender-based violence affects women and girls the most, but men and boys can also be victims. It harms our families, weakens our communities, and undermines peace in South Sudan. Ending GBV is not just a women's issue, it's a community issue. It's about protecting everyone's right to live free from fear and harm. Join CitySam VM in creating a peaceful South Sudan. Together, we can end gender-based violence. This message is brought to you by the Ceasefire and Transitional Security Arrangements Monitoring and Verification Mechanism as part of the 16 days of activism against gender-based violence. Let's unite, act now to end violence against women and girls in South Sudan.
As floods approach, our government is prepared. Local teams are ready to assist. Stay calm, follow official guidance, and prioritize your safety. Together, we protect our communities. Act now.
This message is brought to you by the Ministry of Water, Resources and Irrigation under the Regional Climate Resilience Program for Eastern and Southern Africa with funding from the World Bank.
Good morning, it's iRadio.
Right, welcome back from the break. 25 minutes now after the hour of 7. You're still listening to the Dawn program here on iRadio, live broadcast from the capital, Juba. And I'm still joined live in the studio by Mr. Repen Kamis George and also Reverend Janet Michael. Now, Reverend, let me bring you in. And what do you make of the important points mentioned by Kamis? Especially the challenges facing health workers in general, and especially nurses.
Okay. What Repent has brought is truly, when we look at most of the health workers, the majority are females. The males are very few. And this
they don't like the profession, or what?
Well, traditionally, some time back, most were 90% were actually female.
Female, okay.
But now we are having male nurses. I mean, we have been having male nurses, but now we are having male midwives as well. Therefore, they are also subjected to the gender violence even within their work. And as Repent has put it very, very clearly, we need to safeguard them. The community needs to be aware that these people are helping them. We have lost several health workers in the spur of their work. And then one of the things, issue also that has been rising is in some of our communities, refusing a health worker who comes from another state. Sometimes even choosing to have a lower level trained personnel in their community over a well-qualified person because that person comes from another community. And here what we want to say is that health workers have taken an oath to serve all communities.
Regardless of their background, where they come from.
Regardless of their ethnicity, racial, religion, gender, whatever it is, they are to serve humanity. So therefore, these people need to be protected by the community, need to be helped when they are in the community. Our community need to accept them and accept their services. So long as they are doing the work of helping the community, and that is what we want the community to support. If the community decided to segregate or decided to discriminate against the health workers, that this one does not come from us, we want a person from our area, it is actually affecting the health system, because at the end there will be no services. And this has happened in some community, refusing the health workers, ending up with the facility closed because there is no other person. And as we look at the issues of gender-based violence, we also want to see that the legal framework and law enforcement and the laws that exist has to be enforced. So there is an urgent need, of course, of our government to enforce and protect women and girls. And in a vulnerable situation, we have seen that more violence. In this situation of conflict, the recent conflict and during floods, we see that more violence has been protracted against the women and girls. More are being raped, more are being beaten, and the girls are getting pregnant at a young age. This is all due a period where it looks like there is no law. Therefore, we as the nurses and midwives are concerned that we have to implement a gender-sensitive law which has to take place. Nurses have, I mean, not nurses and midwives alone, but all health care workers have to be protected. In the past, we have lost. Some doctors have been killed, nurses have been killed, clinical officers have been killed in the reality that they were shot dead. Leave alone aggression within our communities.
Right. And Repen, let me bring you in. And you've mentioned a number of challenges, especially the issue of urgent need to address them, and also protection of health workers, nurses, and also the working environment, among many others. Now, how can all these challenges be addressed by all the stakeholders, not only the association, but also other institutions can also play their part to ensure that health workers and nurses and midwives are actually protected and they are well taken care of?
Thank you so much, Emmanuel. This is a very, very critical question and a very good question. I think we in Sanama, we believe in multi-sectoral approach. That's why we are urging our government partners to work with us, and also the international community like the UN agencies, WHO. We work together to address these issues. This issue cannot be addressed by a single partner. That's why we encourage all multi-sectoral approach for this. That's why every actor should play its part. The government, as Reverend Janet said, that must play their part. With the association, we have to make sure that we advocate that the nurses are provided the resources so that they are able to provide their services. Through the government, through the partners, they should have the protective equipment to protect themselves in their services, and also to have a conducive working environment. Sometimes they're working in a very, very difficult environment, especially outside Juba. They're working in a very harsh environment, and if they don't have the resources, that means they're put there in risk their lives. So we are urging the government to work together with us to make sure that the nurses are provided the necessary equipment, the resources that they need. Otherwise, this alone will even increase the risk of burnout and leading to the nurses and midwives and all healthcare workers leaving the profession. So that's why we are here, to advocate, to make sure that all the parties plays their role, to make sure that we have the resources for the nurses and midwives.
Right. And Reverend, is the government playing its role, especially Ministry of Health? I understand there are numerous challenges looking at the welfare, looking at the issue of delay in the salary, and among many others, but what can be done?
Thank you very much. I think you put it right. The issues of salaries is affecting all people. And most important, when we look at the health workers, how can they provide a conducive environment when they don't have anything to eat? They don't have transport. The issue of salaries is affecting, and it's making the nurses and midwives actually to leave their job, which is a very big loss to the government, a very big loss, because after training them, we expected them to do the work, especially where our indicators of health are very bad. We expect the midwives to be in their workplace so that we can reduce the maternal mortality rate. When you look at the budget of health, is so low. 1.3% of that is the national budget, and when it is spread out, it cannot actually achieve what it's supposed to do. Therefore, the health facility, we look at, when we look at health facilities, we are looking at infrastructure. Is there water? When there is no water, as Repent has mentioned, it causes infection to the health worker. Without water, I will not be able to work. The nurse cannot be able to work. Without protective equipment around, like gloves, are run out. You don't have. There is no water. There is no light. There is no. Most of the time, as he puts it, it stresses these health workers, especially the nurses who are there 24 hours working at night, especially night shift. Our nurses have been complaining, and midwives, you are having a delivery, there is no light. They use their own cell phones.
Karaba
Mafi, yes. They use their own cell phone light so that they can execute and do the duty whereby they are supposed to be provided for. And it stresses them. And for you to use that cell phone of yours, you also need money you need to charge. And at times they have to use also calling emergency calls using their own money for trying to call for, and trying to be innovative where there is nothing so that they can try to provide. And imagine the nurses and the midwives are also exposed to, they also carry the load of the mothers and the patients who come to them. A mother is in the ward, does not have food. The nurses have to provide food. They have to look for food. When they are not earning anything, where do they get the money for the food? Because they know essentially the child needs food, the mother needs food. And sometimes these ladies came for delivery with nothing. They will have to look for some materials to hold the baby. You know, they sacrifice so much. And sometimes when they are burnt out and completely stressed, they leave.
They desert actually the profession
desert.
and go for maybe private.
Sometimes
kind of
it's too much.
clinics.
Sometimes you find them crying. And of course, we look at it that we need the government to seriously support, even if the salary is margin, but prioritizing that these are essential services is what we need. Because sometimes we look at what is our priority in the country. Today, when we look, people say security. But I will say the frontline workers are the health workers. Sickness is a high priority.
You even have cholera now disturbing the country.
The security. And who are working in those facilities? It is the nurses and midwives who are there 24 hours. They are the frontline workers who need to be recognized, who need to be supported physically, mentally, and to see that they have a place to stay in.
Right.
Because sometimes there is no accommodation for the nurses. They are traveling from very far areas. Today in Juba, it is so costly. You are staying in Gurei. How do you come to Juba Teaching Hospital?
Or Lemungaba even.
Yes.
Or Gumbo, for instance.
Yes. It is so hard. Therefore, we are asking for all our communities and the government to look at the flight of the nurses.
Right. And Khamis, let me bring you in. How best can the association be supported?
We are calling for our partners and also the community also to support us, because we are there for the community. The community has to support us also to look at the nurses and midwives who are working there. They are there to save lives. Their welfare also has to be taken into consideration, especially in very, very rural areas. Once they are there, the community leaders who are there must make sure that the security of the nurses, of the midwives, of the doctors are also paramount. So they should help us in this regard. So that is my appeal to the government, to our partners, and also to the community to work together to make sure that nurses and midwives, once they are working there, they are working to save lives, and their security and their health are also paramount, should be considered. So that is my appeal.
Right. Let's go for this short break, and after that we'll pick few calls on 0911 or 22 986 986.
أبوهات وأمهات ومقدميت الرعاية حملة تطعيم ريجة تاني مرة ضد شلل أطفال وكده جا عشان تكون بهم إيالتكم الأمور تمن أقل من 5 سنوات من شلل أطفال. حتى كان إيالتكم عملوا لهم تطعيم قبل كده لازم أمون بلقوا لقاح شلل أطفال ده من أجل زيادة تحماية تمن. وخلال حملة التطعيم ده إيالتكم بلقوا قطرتين من لقاح شلل أطفال. في فريق بيجان يلفوا من بيت لبيت عشان بتايموا إيالتكم الأمور تمن أقل من 5 سنوات ومن بعمل علامة في إيدا الشمال. وفريق ده كان موصلوا في بيت التفي فوقه أو قرية التفي فوقه أو محل التفي فوقه لازم كتبوا وري للشيخ الحلة تتاكم أو زول الكبير في محل التفي فوقه ده أو يتبروها في أقرب محل تمرفق صحي. شلل أطفال ده بقدر سببوا شلل وحتى إيال ده بقدر موتوا. لازم كده تتايموا إيالتك يا ليلة عشان لقاح تشلل أطفال وآمن ومجاني. عشان تبعرف معلومات كتير قوم بزيارة أقرب مرفق صحي منيتا أو تبقدر دوقوا في رقم المجاني ياو 6666 أو 2222. رسالة ده قدموا لكم من وزارة الصحة ومنظمة الصحة العالمية ويونيسيف وشركات تومون.
Radio for reliable and objective news from across South Sudan and beyond. You are listening to iRadio, bringing you programs that offer you an in-depth look at the issues that affect you. iRadio, your eye on South Sudan.
It's the break of a new dawn, and this is the dawn on iRadio.
Yes, and welcome back from the break. It's now time to pick calls from 0911-022-986-986. iRadio.
Good morning, Emmanuel J. Akile.
Yes, good morning.
Yes, you are connected with James Door.
James Door, welcome.
Yeah, thank you. Emmanuel, I have 2 questions to the guests in the studio. So your line had been really so busy since morning. Now it has just gone, but I was having some issues that I would want to raise before, but unfortunately it has gone. With this program, I would like to know from guests their strategic plan on how to make this issue of cholera outbreak successful, because people now are really affected in most places which are not really getting some health facilities. Like, for example, the counties, Boomers, Payams, these places are seriously affected by the lack of facilities on the ground. So what should the government do, as well as the partners, to make sure such people are rescued? The second question is, this issue of clean drinking water become problematic to our country. So in which way should we really make it to happen that we have a clean drinking water in the country? Because this had been a thing that's been advocated for years, and none of the government officials or authorities concerned are responding to this case. What can we do as a country to make sure this clean drinking water, even just simple hand pumps, are not in some areas? So how should we make it?
All right. Thank you. Thank you, James Door. iRadio.
Good morning.
Yes, good morning.
David Magog from WOW.
David Magog from WOW. Welcome, David.
Let me welcome your guests in the studio. And I would like to appreciate them first. The nurses, soldiers, journalists, and the teachers are the people who have really sacrificed themselves to work for the welfare of this nation. May God bless you for that. I have 2 questions to them. Number 1, do you meet with the Minister of Health plus Under Secretary to tell her about all the problems facing the nurses? Because the minister do go to executive meeting, council of ministers, of which she do meet the president. If you do complain this, why is he not raising the problems of health? This is number 1. Number 2, all the hospitals, they don't have medicines. And the nurses are always present there.
and there are no medicine inside the hospital. Now, who is supposed to be blamed here? You are present and no medicine hospital. The doctors are deserting the hospital because they don't want to work for free, because they need money. But they are not being given. Who is to be blamed by then if the government is saying it's not paying the salaries? Because then you know very well education is business. Your father paid money to study. When you finish, you work to pay back what you were given for. So as the people concerned, your association, why is it not going deeply to those who are concerned so that the nurses are being given something for their welfare? Because they sacrifice themselves to work for the people, and the government is supposed to work for them. Thank you.
All right, thank you. Thank you very much, James Dor. iRadio.
Good morning, Emmanuel.
Yes, good morning.
It's Diang Ding.
Diang Ding in Wow, welcome.
Thank you, brother. Before I ask my question, I need to know the guest, is he from Ministry of Health or from the partners?
Yes, one from the association and one from the Ministry of Health.
Association of Nurses, Midwives?
Yes.
Yeah. Actually.
And one from the Ministry of Health as well. Association, yes.
The first person I want to ask is somebody from Ministry of Health. You know, the problems of South Sudan National Ministry of Health is that they lack a strategy for the health outbreak, for any disease outbreak. You know, another thing, ignorance of a health profession. They totally confuse the health work. So this is my question to the person in the ministry. What is wrong that the ministry have confused the works of health profession? Because the health profession, there is medical doctor, there's a midwife, there's a nurse, and even public health officers. And you get that in South Sudan here, the public health officers are the right people actually that are, they are the soldiers for any disease outbreak, because they are there to give awareness. They are taught in health education. They are professional in that. But you get that the work of public health officers is given to the nurses and midwives to go and create awareness. It's provided that the midwife is supposed to be in the labor room to deliver the women, provided the nurse is supposed to be in emergency to give attention to the sick one. But in South Sudan here, the nurses are running in a broad field creating awareness, and the public health officers have been graduated 8 years and they deserve the field they went to other fields. What happened in the ministry? You get the medical doctor is giving a health education. It's because of money. What happened to the Ministry of Health? Corruption become rampant in the health ministry. Partners are pouring the money to the health ministry, but you people are not doing right thing. What happened? That's my two questions to you. Please tell me a detail. Even if you are a junior staff, let me know why a Ministry of Health in South Sudan become more corrupt. Then to the you association.
All right.
Committing yourself. You are committing yourself doing the right thing. But why is it that things are not put in order to make sure that the teams arrive in time? You see, the caller can kill more than 10 people, and you get that the data are not released to make sure that is the caller.
All right.
Is not identified.
All right.
Thank
you. Thank you very much, Dieng Ding. Let's come back to our guests in the studio. We have about 13 minutes to the top of the hour. We have James Dor in Juba, David Magog, and Dieng Ding in Wow. We have a number of questions from three of them. So who wants to start first? Yes, Reverend. I can see you're laughing. You want to respond? Go ahead.
Thank you for all your concerns about the health of our communities. We'll go to the first question. Of course, the first question, whether we have a strategic plan to address cholera. Yes, there is a strategic plan to address cholera. And I want to say addressing cholera is all of us. Is all of us to stick to our healthy behaviors. You know, the healthy behaviors, washing hands, making sure that your utensils are clean, making sure that you keep flies away. And these are a collective responsibility. So the government has, and there are facilities that have been set up for taking care of the cholera people. But of course, it's expanding because there are so many factors he brought in the issue of clean drinking water. You know, it's not the responsibility actually of Minister of Health to provide clean, it's the Minister of Water Resources. We actually have a shared responsibility. The Minister of Environment and Sanitation, Water Resources are outside the Minister of Health. But the Minister of Health, for us, we advocate that have clean water. The simple thing is boil your water. And I think that is the message that is going out to the community. Boil your water so that you have clean water. There's nothing here we have to change. Just boil your water. Because we cannot, when the water is polluted, the way we look at that, we are also responsible for our environment. We are contributing to the sanitation of our environment. We are making our environment dirty. If you see the way our rivers are, all are littered with the filth and going to the river Nile. Definitely this is going to affect us. Everywhere you are seeing dirt around, we are responsible for the littering. We don't want to keep our environment clean, and I think that is a responsibility of every and each individual person. It went on also, I think David Magog talked of about whether the Minister of Health know about the situation. The minister knows about the situation. The undersecretary knows. We are sitting in the ministry. We discuss everything. We know that there is an issue with the human resource. So many have been graduated, are not being able to be employed also to provide the services, even that there is a shortage. They all know it. And we know that with the budget that we have, we are not able to buy our own medicines. So even when we talk of the partners who are supporting us, they are bringing another support, which we are not getting anything. There is what they call zero cash policy. It's not given to us. We receive what they give in kind that they supply, the medicines. Of course, most of the time, medicines which are, you are not in control. If you are not in control, somebody is doing something for you. They also do their part, but not completely, because it's supposed to be with the government, and especially where there is a limited budget. That's why he said our government is not able to procure medicines for the whole country. That budget cannot bring medicines and pay the health workers. And when we are talking about this, Adeng brought in the issue of public health, I think the issue of awareness is all of us.
Talk about disease outbreak, confusion, corruption, among many others.
So many things. The issue of health, creating awareness to the public, is not only public health officers. Public health officers actually should look at the sanitation and the public health situation, other than the awareness. The awareness is for everybody. Whether doctors, they have to do awareness. Whether nurses and midwives, they have to do awareness where they are, to do an awareness to the public so that they are aware of their health situation. The issue of corruption he brought in, I want to say the whole country is corrupt. It's not Minister of Health alone.
Yeah, sure.
Today, if you want us to discuss corruption, it's a very big topic, which I'm not going to discuss about it. Corruption is everywhere.
Rampant.
Rampant.
Right.
So
yes,
I will.
Yes, let's bring in.
Here.
Let's bring in Epen Kamis. Yes, you can add something, and of course, you can go ahead. Yes.
Thank you, Akile. I think David Magog is talking about we are not going deeply as an association, but I want to talk to David that We usually have our International Nurses and Midwives Days, and we usually invite minister and we sometimes undersecretary, and all the issues affecting nurses and midwives usually are shared. And not only that, if we have any opportunity of meeting the minister and the secretary, we usually discuss about those issues. We have a technical working group. We discuss all the issues affecting nurses and midwives. So we are usually going deeply. Not only that, we have all the branches in the states, and they usually present at the state level. They present issues affecting nurses and midwives. So I want to talk to David that we are usually going deeply. Okay, that's why we are here today discussing the issues affecting. The issue of the public awareness, public health, I think Janet has talked about that. It's the responsibility of everybody, nurses, midwives, public health, and public health should lead this. You know, nobody's preventing them from doing that. They should lead the issue of awareness, but it's everybody's responsibility. So thank you.
Right, we have a number of comments here. Altima Arimo wrote, hello mother, nice seeing you and listening to you talk on important issues, issues related to health. I am Irene, daughter of Victoria, your colleague.
Wow.
All right. Let's pick one or two calls before we can wind up. 0911-222-986-986 whatever you في استديو حات اي راديو في صباح اليوم. اتصل علينا وقدم سؤال بتاعك او تعليق بتاعك للضيوف بتاعنا في الاستديو. بنتكلم في موضوع بتاع الصحة. اي راديو.
Yes, hi radio.
Yes.
Yes, you are connected with Johnson from Wow.
Johnson from Wow, welcome.
It's good that me to hear that issues related with environment protected and issues related with health care and facilities establishing to the people who are vulnerable and all this.
Yes.
Let me underline this because here in South Sudan, you know, we are really lack of infant. It's like us from all across the country that people are even sick, nowhere, breastfeeding mothers, pregnant mothers are now affected, and there's no facilities. So this needs really to address it, because if we are talking to our government, as one of mentioned there in the video, that government cannot do all these parts. Yes.
All right, thank you very much, Johnson. I think Reverend, you can briefly comment on that, the importance of the challenge of lack of facilities in general in the remote areas across the country. How can it really be addressed?
Of course, we have, of course, our system works in the tiers that we have the PHCUs, and then we have the Boma Health Initiative workers who are supposed to be the connecting with the community. Some communities have them, some communities don't have them. And then we have the referral to the primary health care center. So it's a system that transcends from down. And of course, I know that as we went around, some of these facilities are closed. They were there, but because of the issues whereby there is no payment for the health workers have left the place. And this, of course, bring in the issue that people are lacking. But then I just want to say one thing that to all our listeners, that most of our diseases are preventable diseases.
Right.
And when we talk of preventable diseases, that if we eat well and we are concerned about the environment, like people are given mosquito nets, they don't sleep under the mosquito net. They kind of use the mosquito net for other things. And there is a lot of misuse, which would have been able to prevent malaria. And of course, in our rural area, we know that if people are doing agriculture, they'll be feeding well. But then, with the issue of insecurity and conflict where people are moving from place to place. This is why there's scarcity
Right.
of food.
Right.
So,
right.
Yeah.
Right. We give you each 30 seconds for your last message because we're running out of time. We have about 2 minutes actually to wind up. Yes, Repen, let me come to you.
Thank you so much, Emmanuel. I want to once again appreciate the listeners for tuning to iRadio, and I also want to thank our listeners that ask questions. We appreciate those questions. I want to urge all our community to make sure that as we are in a season of celebrations and also we have an outbreak, let's adhere to our health behaviors so that we can really celebrate well. Thank you.
Right, thank you very much. 30 seconds, please. Yes.
Yeah, thank you, our listeners. Especially, I want to thank my daughter Irene, who is out there listening to this.
She said from Dallas, Texas,
from
in
Dallas,
the US.
Texas.
Yes.
Thank you very much that you are listening to our programs. And of course, I want to also echo the same thing to our people, that our listeners. That is a festive season. Wash your hands. Don't eat those biscuits when you go visiting without washing your hands. Help yourself by staying healthy. Healthy behaviors are very important.
Right.
Please.
Right.